This is Dr. Virana from Huapai Dental Care. Today our video is on oral hygiene, correct brushing, flossing and interdental techniques. First of all, we don't recommend any of our patients using a hard or even a medium toothbrush. We recommend a soft, and that is even no whitening head toothbrushes. Reason for that is if it's got a plastic butt in the middle, it's going to be a lot more abrasive, and that's how it whitens the teeth, but at the same time it recedes the gums as well as wears the enamel. In that case, what we recommend instead of that is your normal soft brush. Make sure you don't hold in a fist grip, which generates a lot of force. Just nice and light, that way you got tactile sensation if you go one finger up. Try as far as possible not to brush front to back, either on the outside or on the inside. On the top you can do that because you've got nice solid enamel on the top there, but not on the sides. So the ideal technique is the roll-on or the flick technique. Whether you're using electric or manual, I recommend the same technique. The reason I don't recommend holding it on each tooth or moving it around the side is if the brush is oscillating or spinning on one point, it's essentially just wearing that side of the tooth, and that's what we want to try and prevent, that wear. So just the roll-on or the flick technique works best. The second thing is the flossing. You can use either the handle or just the normal floss. If you're using the normal floss, just wrap it around your middle fingers, take your thumb and index finger together, and that's all the space you need to floss. When you're flossing, make sure you don't go straight down into the gum. That'll hurt. Don't go at angles, same thing. All you want to do is adapt it to the tooth, go down in between and then up and then to the other side, and don't floss too deep into the gum, and especially don't go across if you scooping out food and things like that, because every time you do that you're cutting the gum, you create a bit of inflammation, which then causes that space to get bigger by resorbing the bone. If you get food traps where you're scooping food out with the floss, or using more especially if you're using toothpicks, which is going to cause that space to get bigger, cause more food traps, and it's going to then contribute to gum disease. Instead of that, I would recommend these little brushes called interdental brushes. You always want to check with your dentist for the smallest size for your teeth, and then all you want to do is make sure you go in between, pushing the food out but making sure that it comes across to the other side. If you find that it's difficult that way, try and come from the other side. If you got the brush turned at a slight angle that way, and then you're trying to go in, you're going to push the food into the gum, which can be quite uncomfortable. You must make sure that it goes all the way through. And that's the oral hygiene video. If you have any concerns, just give us a call. Thank you. Bye.